How's it going, guys? Past level question, cardio step 1, internal medicine 2CK, 36-year-old man. He's got aortic dissection. Okay, not dramatic. Most common risk factor is hypertension. They can tell you straight up, or they can say cocaine, okay, which causes hypertension. You have to know that. Otherwise, it could be Marfan syndrome, Ehlers-Danlos, but we're handing you the diagnosis, aortic dissection, and then questions asking what kind of murmur are you going to see? And I've talked about this in my PDFs and other YouTube clips. Let's just walk through here. So 2 on 6, continuous murmur, wrong answer. So continuous murmur, aka pan-systolic, pan-diastolic, or to and fro murmur, is going to be your patent ductus arteriosus, which USMLE wants you to know is an extra cardiac left to right shunt. It is also congenital rubella syndrome. Those are the kids who get PDA. Wrong fucking answer. Choice B, crescendo decrescendo. Wrong fucking answer, aka mid-systolic murmur. This would be aortic stenosis, can be pulmonic stenosis. All right, so congenital bicuspid aortic valve, obviously most common cause of aortic stenosis, causes slow rising pulses. Okay, pulses parvus et tardus, can present with SAD, syncope, angina, dyspnea. 2CK stuff, you're going to do aortic valve replacement if you have SAD or if cross-sectional area of the valves under 1.0 centimeters squared. Choice B, wrong fucking answer. Choice C, decrescendo murmur, correct answer. So you need to know that aortic regurgitation, the most common cause in USMLE is going to be aortic dissection. Okay, obviously it could be idiopathic, but they want you to know that this isn't dramatic. If you have an aortic dissection, can't you get retrograde propagation toward the aortic root, causing aortic root dilatation? Okay, so in contrast to aortic stenosis, as I just described with choice B, for aortic regurg, you're going to get bounding pulses. Okay, so wide pulse pressure, large difference between systolic and diastolic pressure. They can tell you blood pressure is 120 over 40 or 160 over 50. And you're like, wow, that's a big difference between the numbers. Okay, so bounding pulses, head bobbing. All right. Whereas we said for aortic stenosis, it's slow rising pulses, pulses parvus et tardus. So this is very past level, this distinction here. So let's just whip through the other answers. Choice D, early systolic murmur, wrong fucking answer. This will be a flow murmur. Okay. So a flow murmur, a functional murmur, more 2CK stuff. Like you might get a pediatrics case, a kid where there's just a viral infection, heart rate is 90, heart rate's 100. And they'll say there's a 1 on 6 or 2 on 6 early systolic murmur. Or they can just say systolic murmur. And the student's like, oh, there's a valvular abnormality. No, there's not. It's just a flow murmur. Okay, so you can see it very commonly in pediatrics. You can see it in pregnancy with increased plasma volume. Okay, so you can also see it in anemia. All right, so severe anemia, heart rate increases. They'll tell you the girl has heart rate of 100, and they just want you to know it's a flow murmur. Wrong fucking answer. Choice C, late peaking systolic murmur with ejection click, wrong fucking answer, refers to aortic stenosis. Okay, so I threw this in here just to be a little tricky, even though not difficult, because some of you think, oh, like, you know, if you have a patient, let's say, connective tissue disorders, myxomatous degeneration, Marfan syndrome, Ehlers-Danlos, you could have mitral valve prolapse, which is a mid-systolic click. That's different. It's not the same thing as ejection click, which is aortic stenosis. Okay, so we said aortic stenosis is a mid-systolic murmur, or crescendo decrescendo murmur, same thing. But maybe 1 out of 6 questions, they can say late peaking systolic murmur with an ejection click. So you just need to know that refers to aortic stenosis. Choice E, wrong fucking answer. You know the deal. I'm to make more content. If you like my stuff, subscribe to my channel. Appreciate your time. That's it.